Hello and welcome to yet another episode of Cancer Now with your freelance journalist Benedikt Steininger. In our last episode we discussed the basics of this awful disease, but today we will focus on the different stages in cancer, with today's title being Cancer Stages and the Chances to Survive. With me is the cancer specialist Professor Dr. Alexander Herzog from the Fachklinik Dr. Herzog.
Hello, Mr. Steininger.
Today is the 22nd of May and this is the only cancer-based podcast on YouTube, Cancer Now. Before we go to the main topic at hand of today, I'd like to quickly address one or two last questions from the past week's episode asked by our viewers. The first one being, after smoking 2 to 3 cigarettes a day, do I have a higher risk to get lung cancer?
That's indeed a very important question. And the answer is quite simple. It's a question of the dose of carcinogens which are in the tobacco, which you have to take up for a longer time. So we have to see there, in the beginning you have a healthy cell which is attacked by carcinogens, and the more often this cell is attacked, the higher is the risk that a mutation happens and that the cell degenerates and mutates into a cancerous cell. Then you have to wait for years and maybe other repeated exposure to carcinogens, and at the end you have several mutations and you have a cancer. So going back to the user asking this question, the lower the dose, the less is a risk. And normally we count the tobacco consume in pack years. So pack years means 1 pack of cigarettes per day for a year. And the more pack years you have, the higher is the risk of cancer at the end. You also can see, and this is a good news, the longer the break is after stopping smoking, the less becomes your risk again. So let's go back. If you smoked, let's say, for 10 years, 1 pack year or 10 pack years altogether, then 10 or 20 years later, your risk in general to get lung cancer is just slightly above people having never smoked.
Our second question is more about lifestyle choices, which we touched briefly last episode. And that one is, to what extent does nutrition take a role in cancer?
Nutrition is, I believe, one of the most important issues. The last time we didn't really speak about that. We spoke more about general lifestyle. But it's very important what you eat every day. And to find out which is maybe the best food style, you can look on so-called migration studies. So let's take, for example, Italians living in Italy, taking the so-called Mediterranean food style, which means everyday freshly prepared vegetables, fruits, salad, not so much meat, not so much sugar, or good oils like olive oil and also a good glass of wine. And if these Italians, if they migrate to New York, to Little Italy over there, then already in the first generation you will see something changes. So in Italy, if you compare Italy to Germany or to Northern America, there's about 30% less cancer, breast cancer, colon cancer, prostate cancer, and many others. But if these Italians migrate to New York, in the first generation, the cancer rate suddenly adapts to the Northern American cancer rates, which is about the same as the German. So it means 30% more cancers. This clearly shows that this is not a genetic problem, it's a problem of environment, food style, lifestyle.
So basically, if you wish to reduce the risk of getting cancer through nutrition, you have to make sure you enjoy a healthy lifestyle, have enough vegetables, have enough meat, but kind of balance everything together.
Yes, that's very important. So if taking junk food or processed food is a bit dangerous, especially in the long run. If you take that from time to time, that's certainly no harm. But if you don't eat enough fresh products, organic food, then you may run into danger and you increase your risk of getting cancer.
All right, I hope that clears up the questions. And now to begin with today's episode properly, would you care to explain our viewers what stages of cancer there are?
There's the early stage of cancer where the mutation had happened a long time ago, and after a latency period, suddenly now a nodule starts to grow. And if this nodule grows, getting bigger, it becomes a tumor and may become visible. If it's outside, for example, in the breast, the patient may feel a nodule. And then it depends on the size of the nodule. So the nodule continues to grow, reaches 1 centimeter, 2 centimeter. But this nodule is not just growing because it's a malignant nodule, which means the cells have no respect from the healthy surrounding tissues. The nodule and the cells in this nodule start to infiltrate into the surrounding organs also in the surrounding tissues and start to damage them. So you don't have only the size, you also have to look what happens just around the nodule. So this is a primary cancer node. And in the cancer code, which every cancer patient finds on the papers, most likely finally by the pathologist after surgery, you find a so-called PT1 stage. PT1 means the P means the pathologist has seen it, T means the tumor size, and 1, that's the smallest size. So T1 is in general less than 1 centimeter. Then you get the T2, which is 2 centimeters, and at T3 it's even much larger and already is maybe infiltrating into the surrounding tissues, and T4 is a very gross tumor which may have ulcerated the skin around or damaged other organs around.
So does that mean that metastases are happening on stage 3 or stage 4?
Again, this cannot be told from the beginning on, because theoretically, at the first time when the tumor cell divides into 2, the second cell may already migrate somewhere into the body. And so sometimes you even find patients who have metastasis and you never find the primary tumor. This is called CUP syndrome, cancer of unknown primary. So the mother tumor is so small that you just don't find it, you just find the metastasis. But you can say the larger the tumor gets in general, the higher is the risk that some cells may have migrated away from this tumor and going somewhere else. And here we have to distinguish 2 directions. One is a direction into the regional lymphatic system. For example, if you have breast cancer, that's a very simple example to explain, it goes into the lymph nodes in the axilla, in the armpit, which is the next stage of the lymph nodes. Lymph nodes in the body are like the police of the body. They catch the tumor cells and keep them in a cage for a while. So we can see now if the cancer grows, tumor cells may migrate into the lymphatic vessels and then are caught in the lymph nodes. Then we have in the tumor code, we have suddenly appearing an N. So PN1 means the pathologist has seen 1 lymph node involved. Then N2 is also possible, and some other letters, just to explain how much the lymph nodes are involved by the disease. Is just microcarcinosis, or is a lymph node full of cancer? How many lymph nodes are there? And sometimes even if the capsula of the lymph nodes is already penetrated by the tumor cells. So this is all distinguished by the letter N. And then the M, that's the third letter in the tumor code. M means metastasis. And here we have to look at the other pattern of the tumor to spread. So some tumor cells spread into the lymphatic vessels and go into the lymph nodes. Other tumor cells, they migrate into the blood vessels. And then they swim around in the blood as so-called circulating tumor cells. And from there, from the bloodstream, they may get anywhere into the body. Everywhere they can settle down. And now it's depending on person to person and also on the cancers where they tend to settle down. For example, in prostate cancer, the main area where the migrated metastatic cancerous cells of the prostate find a place to settle down is the bones, much later than the liver. In breast cancer, also the bones, then the liver, but also in breast cancer, very often lungs, brain, pleura, and other organs are involved. So we have from cancer to cancer a different pattern, and you cannot really predict where exactly the tumor will show up next.
So as these miniature tumors are scattered across the whole body, how much harder is it to be treated effectively, and what forms of treatment are required?
We have to see as long as the cancer is locally restricted, which means a local tumor and some lymph nodes in the neighborhood, it can be treated locally, and in general it can be cured, or let's say not in general, very often it can be cured, depending how early it is detected. In patients who have cancer with distant metastasis, the situation is different. In these patients, the cancers had the opportunity to swim around in the blood, and they can be everywhere. Everywhere may be already micrometastasis, not visible with any technique. Just look into ultrasound, has a resolution of about 0.5 centimeter, which is already about 1 million tumor cells. CT scan is a bit less, but even 0.25 centimeters is about 500,000 of tumor cells. So if we detect some distant metastasis, we have to wait until they have a certain size, depending on the area where they are. And then we have already a significant tumor load. So treating metastatic disease is much different. Here you would have to look for systemic treatments which reach all cancer cells in the body, whereas as long as a tumor is localized at some spot and just some regional lymph nodes, you treat focally. So you focus on the disease and do maybe surgery, whereas in metastatic disease, you normally don't do surgery.
So in regards to surgery, how has it developed over many years? Because many years ago, you had women with breast cancer have their breasts removed. How is it today? How is it possible to not have a breast removed, or for other people, their limbs removed, for example?
That has changed indeed a lot. So about 30 years ago, the standard treatment of breast cancer was amputation of the breast. Or the standard treatment of bone cancer, for example, in young men in the knee and osteosarcoma, was amputation of the leg, because it was not possible to shrink the tumor in a sufficient way to allow a limb-saving or breast-saving surgery. Nowadays it is different, because now we have many tools like chemotherapy, like radiation, but also targeted therapies. It's possible to shrink the tumor first until it is small enough to do breast-saving or limb-saving surgery. So nowadays the standard, for example, breast cancer is breast-saving therapy. In earlier times it was amputation of the breast.
So this increased a person's well-being in life.
Yeah, not only the well-being, it has also psychological effects. If you have both breasts as a young woman, or if you have no amputation of your leg as a young man, that's an incredible difference in the quality of life, because then you can take part in normal life without being handicapped. So here's a lot has changed in the last 30, 40 years.
In regards to after surgery, how high is the risk of getting cancer again?
Here it depends how early you do the surgery. So at the moment, it's a bit critical because of the COVID-19 crisis. People are afraid to go to hospital for screening, and though they may miss the early diagnosis, which is dangerous, because in this time the disease may spread and may already create metastasis, and if it's 2 or 3 months delay, that could be already too much. But the earlier you treat the cancer, let's say you have a T1, which means a small tumor, and no metastasis, not even in the lymphatic system, you have excellent chances to be cured. And of course, here depends now where the tumor develops. So if the tumor develops in the breast and you feel it, or in the skin and you feel it and see it, it's a big difference compared to pancreatic cancer, where the tumor is inside the body and you don't feel it and you don't see it. And normally, if pancreatic cancer is detected at a size of 1 centimeter, it's just a coincidence. So it's because at this size, it doesn't cause symptoms. Apropos symptoms, cancer's growth normally is asymptomatic in the beginning. So a small nodule, cancer nodule, typically is not painful. The pain develops only if the cancer is big enough to disturb neighborhood structures, so to press on nerves, on bones, on other structures. Then you get pain. So the early cancer is not painful.
So it definitely takes a while until cancer can actually be noticed through pain.
That's also why we have the screening programs. There are screening programs for colon cancer, there are screening programs for skin cancer, for breast cancer, for cervical cancer, and also for prostate cancer. So with such a screening, you are able to detect the cancer as early as possible. But in many other cancers, there's no screening available, unfortunately. For example, lung cancer, there's no screening. Stomach cancer, there's no screening.
So how would a patient find out if he or she has a tumor, if he doesn't or she doesn't feel it?
Yeah, that's a big problem. So if you don't have a cancer which can be detected by screening, then it's a coincidence, to find it early enough for a cure. And very, very often in these cases, you find the cancer in an already advanced stage, which you may not be able to cure anymore. For example, pancreatic cancer, the main symptom would be pain, belt-like pain around your body, and at this stage, very often already there are lymph nodes involved now by the enlargement pressing on the nerves around, causing this pain.
All right. Are there different threats to be considered when looking at various forms of metastasis in specific?
Metastasis may happen everywhere in the body. So depending on the location, you have different symptoms. For example, if you have lung metastasis, you may get shortness of breath, you may get cough, and in serious cases, you may even cough up some blood. If you have liver metastasis, in the beginning you don't feel anything, but maybe at some point you turn yellow. It's called jaundice, or you have pain in the liver when the metastasis press on the capsula of the liver. If you have bone metastasis, you often feel pain And if the metastases continue to grow because not detected as metastasis, then also fractures may happen. And if you get metastasis in the brain, you suddenly may get epileptic seizures or headache or other symptoms like neurological dysfunction, so you may not be able to move your arm correctly anymore. And then you find the diagnosis.
So what are the chances of treatment at this stage?
There are still good chances, fortunately. But compared to the early stages, the likelihood of a cure is only very little. But now with new modern treatments, you're able to reduce the cancer load in a way that the symptoms may disappear. And not only the symptoms, also the tumors may disappear. That's called complete remission. But often you are happy with a partial remission so that the patient can now suddenly live with the disease and live in a good condition and a good quality of life with the disease. That's the goal of the modern cancer treatment. So not just to prolong life, you want to prolong life in a good quality of life. And the smaller the tumor is, the better.
So that was our last question of today, leading us into the second part. However, before we start this, do you have any last words for the viewers?
I think very important for everybody is to really try to live a preventive lifestyle, because always it's better to prevent the disease than treating the disease. Preventive lifestyle means health-orientated nutrition. Best could be the Mediterranean food style. Then every day a regular sports program or activity program, which means about 30 minutes minimum of walking, jogging, cycling, dancing, yoga, Pilates, whatever you like to do. The only thing which is not counting is house and kitchen work. You have to find somebody else to do that. Then that I think is very important, prevention of the disease and not waiting until you have to treat it. Then the second advice is that if there are screening programs available, go for these screening programs. And the third advice, be aware of your body if something changes. Don't wait too long before going to the doctor.
So no experiments, basically.
Yeah, but again, you shouldn't run to the doctor if there is a little problem or a little pain or some whatever. Every day, especially if you get older, you may feel some pains everywhere from time to time, or maybe every day, so you don't have to go to the doctor every day. A good rule to be on the safe side is if you have a problem or a pain somewhere and this pain doesn't disappear in the next 3 weeks or is getting worse, then you should see a doctor and don't rest until you really found the cause of this pain or this problem. If it disappears within the 3 weeks, then it's mostly no problem, nothing, no cancer.
We would now like to come to the questions that were submitted to us from our users. And the first one is a little bit pragmatic, but fits the summer theme. Can you get cancer from having a barbecue?
Especially now in this time of the year when the barbecue season starts, we have nice weather. People, of course, like to sit outside, make barbecue. And of course, it's correct. Yes, having barbecue frequently may cause cancer, especially if the meat is heated up too long. So if the meat is really black and burnt, then cancer genes are in the meat and they may cause stomach cancer.
But does that only involve the meat, or does that involve in general having a barbecue?
No, mainly the burnt meat. So the barbecue itself is not dangerous, but if you tend to eat sausage burnt too much or the steak too hot and it's all black, and if you eat that every day and you like it this time, you eat very often such barbecues, then you run into a high risk to get maybe stomach cancer. So you have to be careful, but if you make the barbecue in a careful way, not overheating the meat, then it's fine. Then there's no high risk.
But how long would that take, roughly?
A few years. You have to eat it. You have to eat several times in a year black meat, burnt meat, and then you increase your risk. If you eat from time to time a nice steak, which is maybe a bit too dark, don't worry about that.
There is also a second question today from one of our users. And it says, I have since half a year continuous stomach pain. However, I also visited different doctors in the past. Could that mean that I have pancreatic cancer?
Yes, before we mentioned pancreatic cancer and also that it's a disease very difficult to diagnose. This patient with continuous pain and the reason obviously not known yet, indeed is of risk that there's maybe something going on. There are different diagnoses possible, for example, stomach ulcers, which may take a while, also some other diseases, but even pancreatic cancer. So here I think we should do a CT scan to make sure that there's nothing going on, considering that the problems now are lasting for quite a while.
Is it pancreatic cancer is one of these forms of cancer where it's hard to detect, or basically only detected when it's already a bit further on?
Yeah, you're correct. Pancreatic cancer, the diagnosis very often is quite late. So you would wish in this disease, in particular in this disease with not a good prognosis, you would wish to have an early detection when the tumor is less than 1 centimeter. But in these stages, the patient normally doesn't have pain. So the pain derives when the lump or the nodule gets bigger and compresses structures around, or if there are already lymph node metastasis compressing the nerves around. This makes this typical belt-like pain.
So on average, when you look at your past patients having that form of cancer, at what stage were they diagnosed?
Pancreatic cancer, most of patients get the diagnosis quite late, most of them already metastasis. If you detect the disease earlier, it's very often a coincidence. So you do another diagnostics and you suddenly find a nodule there. Or sometimes people get jaundice because tumor presses on the bile duct and has not created metastasis yet, and then people become yellow in the eyes, and this can lead to an early diagnosis, earlier and early enough to do surgery, which may even end in a cure.
So when would it be too late to react to this form of cancer?
It's never too late. I mean, you have to accept the situation as it is. So if the disease is advanced and you cannot do surgery anymore, then you have to go through other programs. Other programs could be chemotherapy. There are different protocols. We can talk about that later on when we talk the specific topic, pancreatic cancer. There's also radiation possible. And if, for example, the bile duct is blocked so that the bile from the liver is not flowing into the bowels anymore, then you can put a stent in to open up the bile duct again. So many methods are there to hold the disease, to control it, and to allow patients to live longer.
Thank you so much. And these are this week's questions from our viewers. However, if also you are interested in sending us any forms of questions, you can do these by commenting below or by submitting your questions via email on our social media accounts.
I believe it's very important to ask questions as a patient, because that's also one of the reasons why we do this podcast. We want to increase the competence of patients, and there are studies showing that more competent a patient is, the better is the outcome. So please ask questions if you have questions, and we try here to explain all details.
Therefore, thank you very much also for your input about the questions, and this is everything for today. So thank you very much, and we will see you next time.
Yes, you're welcome. See you the next time.
Although cancer is a life-threatening disease, it is certain that when diagnosed early, the chances of a cure are notably higher. Thanks to modern medicine, various forms of treatment have been developed to shrink a tumor successfully to then be operated after. I mean, while the risks of reoccurrence through metastasis still exist, there are measures available to recognize these early. In our next episode, we will discuss how your own knowledge can help you survive this disease. If you enjoyed this episode, leave a like below and subscribe to our channel, or follow our social media accounts to never miss an episode. This was Cancer Now with your freelance journalist, Benedikt Steininger.